This
Welcome.
conference will now be recorded.
Welcome everyone to the RMC support group um, for this month. Um, Glad to see everybody. And just, I just wanted to let, especially the new people know and just understand like the importance of this group and why we, have this group and, do this group every month. We are, you know, uh, a small knit family or whatever. We share our shared experiences and our journeys. A lot of us are at different phases in our journeys. We have caregivers on here as well, family members and caregivers and people that's going through the journey currently and people that have, you know, uh, came through the journey to the end. So I just wanted to give that quick introduction. Um, so what we're gonna do now is we're gonna go around and introduce ourselves to the new members of the group tonight. So I'm going to start. My name is Andre Sneed. I'm one of the moderators for this support group. I was diagnosed with RMC back in April 2019. Um, I got my kidney removed first, and then I started, my chemo treatments. So I did that for about, I did 3 different chemo regimens. Also, I did it in conjunction with, did 28 cycles of radiation. So my journey was about 18 months long, and I got my first clear scan with no signs of cancer in October 2020. And I let Miss Ritchie know that hey, we need a support group. So we kind of made that happen, and I'm glad we did. So um, that's my story. Um, Brian, you want to give a quick introduction and let everybody know your journey?
Sure. Hi, everybody. My name's Brian. Like Andre, I was diagnosed with RMC. I got diagnosed back in like June of 2021. First, they diagnosed it as regular clear cell, but after going to MD Anderson, um, they found out that it was actually RMC. Before they found out it was RMC, I went ahead and got my left kidney removed. And after I started treatment at MD Anderson, I went through 2 different rounds of chemo, or 2 different regimens of chemo, I should say, in conjunction with the trial drug and the radiation. Um, so I did that for a couple of years, and as of October-ish of 2023, I am currently cancer or no evidence of disease. So that's my story.
Thank you, Brian, for sharing.
Sure.
Um, Ash, Ashley, can you give us a quick introduction, about your journey?
Absolutely. Hi everybody. My name is Ashley. I was diagnosed with RMC on December the 3rd of 2024. I have my left kidney removed as well. And I've been on chemo since January. I'm switching regimens right now, switching over to I don't know how to pronounce it, but it starts with a D and then gemcitabine or something like that. And I haven't
Doxorubicin.
started it yet. Yeah, that. Um, and I'm being treated at Emory in Atlanta. Um, I'm pain free, like flank pain free. So that's a good thing. And that was done in the very beginning of my journey. I'm honestly glad my kidney's out of there because I never felt better. So that's all I got to say about that for now.
Thank you, Ashley, for sharing. Um, let's go to Carissa. Can you give us an introduction and your connection with RMC?
Yeah. Hi, guys. My name is Carissa Moran. Back in 2016, after 6 months after I got married to my husband, Carlos, he got diagnosed with RMC. During that, we live in New Jersey, so he was getting treated in New York. Um, in June 2017, he was in remission, but after, I would say, October, looked like it was coming back, and then in January 2018, they saw that the cancer came back during that time from June 2018 to April of 2020. He was treated, had different treatments in New York, and then we eventually went to MD Anderson, where he had some clinical trials and different treatments there. And he passed away on April 28th, 2020. Thanks, Andrea.
Okay, Carissa, thank you for sharing.
Andre, you're in twice.
Yeah, I just came in on my computer. I'm about to hang up my phone.
Okay. Okay.
All right, can y'all hear me?
Yeah, we can hear you, Andrea.
Okay, perfect. All right. My computer was acting up earlier, so I had to get it to go. Um, George, can you give us a quick introduction, about your journey with RMC so far?
Absolutely. Can you hear me?
Mm-hmm.
Yes, we
All
can.
right. All righty. Name is George. I was diagnosed with RMC last August, actually. Um, and I had a mass on my left kidney. So they had to go in and remove the kidney. Then thought I was in the clear, and then they found some spots on my lung and on my adrenal gland, my left adrenal gland. So they started treatment here. I live here in Reno, Nevada. So they started treatment out here, and the first medicines that they were using wasn't working. It um, seemed like it was starting to spread. So my oncologist gave me the information about Ritchie's foundation, and to contact her, which I did. And so my oncologist started communicating with Dr. Masul in Houston, and he suggested one of the trial medicines. I believe I know it's called doxorubicin, or the nickname is the Red Devil. But so I started that. Got treated for 9 months or so. I mean, yeah, about 9 months. Um, every other week, and then I would make flights out to Houston just to because I wanted to meet Dr. Masul and get to know him. So I've been making trips out there like every 2 months, getting scans. And I just got back Saturday. I was out there. So I met with him Friday, and he told me that I had no more activity in my body. So, which was a shocker, it caught me off guard. But and I'm still in shock. I'm not gonna lie. Still very cautious about everything, but he was really pleased. He was excited, and that's where I'm at right now. He wants to. I'm kind of almost at the end of life as far as that doxorubicin goes, as far as how much I can take. But he wants to kind of give me a little bit more, just as I guess precautionary measures. He was concerned about the spot on my left adrenal gland. He knew it was cancer before, but now there's no activity there. But he just wants to kind of push it to the limit as far as my the medicine goes, and just as precautionary measures. So I will meet with my oncologist out here next Tuesday, and then figure out how many more treatments I'll have to have and take it from there.
All right. Thank you, George, for your intro. Brandon, can you give us a quick introduction, about your journey?
Yeah, how's everybody doing
Good,
today?
good.
So,
Yes.
um, I first got diagnosed. Well, I was hospitalized September of 2024. I was hospitalized because originally of a UTI and bad flank pain, and then ultimately they found a mass on my kidney. They told me it was a mass on my kidney. I was like, okay, it could be cancer, but we don't know if it was benign or malignant, whatever it was. But a few weeks later, I returned back to Fort Bliss. I was stationed out there in El Paso, and we did a biopsy, and I was diagnosed with RMC. They kind of suspected in the beginning, so they talked to me beforehand and told me that there was this type of cancer. They're hoping it wasn't the way it was looking. It probably was, but then it came back to be RMC. uh, Immediately after that, like a week later, I started treatments um, there. My doctor reached out to Dr. Masao because he didn't feel comfortable with it. And after some maneuvering around, I was able to move here to Houston in April. Just recently, in June, I had my right kidney removed and lymph nodes. And Dr. Masao said, I think 7 of the 9 lymph nodes came back cancerous. But after our recent talk, I met with him a few weeks ago. After we did another scan, everything in that area is gone. All the cancer from my kidney area and the lymph nodes, it is gone. There's one spot in my kidney, my lungs and lung area is there, but he knows that a second spot started to grow in that area also. So he kind of suspected that anyway. That's why he said he gave me that time off from the chemo treatment so that the RMC can show itself and he knows what to do. So he was pretty happy with it. But I started that chemotherapy immediately after. We're on the decitabine, the doxorubicin, the Paxil. Um, but other than that, I'm supposed to be I have treatment coming up actually again this week. And this treatment here hit me harder than all the other treatments. It's like I've been off for a while, and then once I got back on, it was like different on this one. But I am supposed to be meeting with Dr. Tang in the next week about radiation therapy to try to handle that because he's like ultimately when I start radiation, he's gonna knock me off 2 of the drugs and on one. So that's where we're at right now.
Thank you for that intro, Brandon. Um, we're gonna go down to Mr. Edwards. Can you give us an introduction, please?
How's everybody doing? Y'all can call me Todd for short. Hopefully, if it's a little less on to be a mouthful. I went to the hospital. I got a little lucky, I think, because I didn't even know. I got bit by a dog. Went to the hospital because I had an adverse reaction to the medication they gave me, and I had a bunch of stomach pain. And it was like, oh, you just happen to have like GI issues along with something on your kidney. And I was like, okay, kind of a blessing in disguise we found that because obviously I wouldn't have never known. But so it's been about 3 months now. Um, just on carboplatin and Taxol at the moment. So it's about coming up to my third cycle. And yeah, that's pretty much it. Did I miss anything actually?
When
No,
were
that
you
was
Okay,
fine.
diagnosed?
good.
When
When
were you diagnosed and where do you live?
Oh yeah, I live in Raleigh, North Carolina, and I was diagnosed say May 26th, May 27th, one of those two. And I get my cancer treatment at Rex Oncology by Dr. McNamara, and she also works with MD Anderson as well for the treatment.
Okay.
Which stage did they catch it at? Was it stage 4 when they caught it?
They originally thought stage 4, and they did another checkup, and they said, okay, it's only stage 3. The CT scan caught stage. They said stage 4, but stage 3 was confirmed on the PET scan. So
Ah.
That's
yeah.
good.
So yeah, I got really lucky there. But yeah, that was like I said, it was a crazy fortunate event. Like I said, getting bit by that dog seemed like a curse at the time, but I'm glad we figured that out because obviously I would have never known and I would have never felt anything. So it would have been a kind of a bummer.
And if you don't mind, Ty, when you get an opportunity, if you can drop your email, your information so that we can stay in contact with you.
Yes, of course. I'm dropping that right now.
Okay. And do you have my information by chance?
I do not. Also, by the way, if people left me theirs last time, I didn't know that when the meeting is over, all the information closes.
Mhm.
So if anyone felt like I left them on red or I didn't talk to them, it's not that. I just didn't know. So I know there's a Brandon. I don't think he's here this round, but if anybody sees him, tell him it wasn't
Brandon,
personal.
Brandon is on.
Yeah,
Oh,
that
you
was
are. Hey, Brandon.
hey.
Sorry about that. My number's in there now. Shoot me a text and we'll catch up.
All right, appreciate it.
But yeah, so
appreciate the introduction, Ty. Appreciate it. Um, let's Alex, can you give us an introduction and kind of like your connection with RMC?
Yeah, absolutely. So, like I said earlier, I'm from Montreal, Canada. All of this started for me in March. That's when I was diagnosed around mid late March, following about a month and a half to 2 months of having uh, cold like symptoms, but mostly a really bad, uncontrollable cough. At first, I went to see different doctors. They thought I had sinusitis, different types of infections. No one actually took an x ray or a scan or took it more seriously. Like I said, I'm from Canada, so the winters are brutal and everyone has all these types of viruses. So, no one really tried to push further. In the end, though, my cough was really uncontrollable, and I started having a lot of fatigue, so I couldn't work anymore. So I went to the hospital, and an initial X-ray revealed that I had a lung infection, but that I probably had something else going on. So they hospitalized me, and over the course of the next few days, they took a sample of my lymph nodes, which confirmed that I had RMC, so it had spread from my kidney. So we had the combination of the scan and the sample. I immediately started a chemotherapy regimen directly at the hospital, and then I was discharged. I got a little unlucky at the beginning. I mean, already unlucky, but even unluckier. I had a really bad allergic reaction to my first chemotherapy treatment. I went into anaphylactic shock, so they had to pause and start over 2 days later. So I started off taking Plaxitaxel, but then they decided to give me gemcitabine and carboplatin instead. that went well for about 2 cycles, but then I had a really bad complication due to that. So I spent 2 weeks in the ICU. And then they decided to start giving me paclitaxel again, but desensitized. So in consideration of allergic reactions, and that's been going well. I've been pretty stable. My scans do look better, but to err on the side of caution, my family and I have decided to go to Houston, Texas at the end of the month to meet Dr. Maswell to get a second opinion and to also hear what other types of treatments or technologies might be available to me. For example, clinical trials. I hear you guys talking about radiotherapy. That's something I'm also interested in. And if eventually I would have to move on to the infamous Red Devil that everyone seems to talk about and know about, I haven't been there yet. So that's pretty much my journey. All of this started in March. So I'm still at the beginning of it. I manage my side effects pretty well. I get to have a good quality of life and just maintaining a positive attitude throughout the whole thing and really well supported, which is why I wanted to join this group. Hearing your stories is really inspiring and it also really gives me hope. So thank you for having me.
That is awesome.
Alex,
Go ahead.
I was going to ask a quick question.
Yeah.
So Alex, when they give you your treatments, did they start with like allergy medicine, like as a pre thing,
So the
or did they
first
give you anything before?
So the first time I had been hospitalized for 2 weeks. So they decided, oh, we're going to give you chemotherapy on a Saturday, which they never do. And they gave me some very basic allergy medication at the beginning. I think it was Benadryl and something else for like vomiting. I think it was a type of
Oh,
cortisone.
Zofran.
It was a very
Mhm.
small dose, and I had that reaction. Now, because of my quote history, they give me a lot more pre-medication. I think that when I start treatment, they give me something like 6 or 7 pills and 2 different infusions, which really helps tolerate the treatment. And so far, so good. I haven't had any other adverse reactions during treatment.
Awesome, good.
That's awesome. Alex, please take my information down. So I am in the Houston area and I would love to meet you, connect with you when you get here.
Yeah, absolutely. So I see your email here, and that's your cell number. Okay. You said that when we leave the meeting, we lose all the messages?
Yes.
Okay.
I just want to welcome you to the group, Alex. Appreciate you sharing your story. And I got treated by Dr. Masal at MD Anderson, and so did Brian, and I think a couple others. But he is very passionate about RMC and really really great. So I'm glad that you'll get a chance to go down to MD Anderson, meet with him and seek the best treatment out for you.
Thank you so much. And yeah, I'm really excited. I feel like it's the best possible course of action for me. And it's also the best way to put the odds in my favor. So I will keep you posted on how that goes. I'm going on August 28th.
Is that the soonest you could get in, or that's?
Yeah, so I've had this appointment for about 6 weeks now. It was the first available date.
I wished I had known because I could have gotten you in sooner.
Oh, that's a shame, but it's okay. My condition hasn't worsened, so and I hopefully it won't in the next 2 weeks, so I should be good. But I really appreciate that. Thank you.
No worries at all.
And Alex, you also said you had a question about radiotherapy, like radiation.
Yeah, well, I'm just surprised that so many of you, we're a small group, but that the few of you that have spoken have experience with it because it's actually something that my oncologist here, it's an idea that he's not really entertaining, whereas research that I've done on it and that my family has done on it shows that it's actually quite beneficial. Every case is different, but it's an option to consider. So, if maybe some of you could share a bit more about that, that'd be greatly appreciated.
Yes, I will. I can share. So I had pretty much 28 different cycles of radiation. So 28 days. It was pretty much Monday through Friday, and to me, it was the easiest part of the process. Took about 15, 20 minutes. Um, each day, Monday through Friday, and radiation oncologist that works with Dr. Masal. His name is Dr. Tang. And he's really great at what he does. We actually had him on a group call some months back. And he kind of talked about, the process, the radiation process and stuff like that. So maybe that's a video we can get to you. I think it should be on like YouTube, but we should be able to get that video to you so you can kind of, hear what he's saying about, radiation and stuff. Um, so yeah, I know Brian also was treated by Dr. Tang. Brian, do you have anything to add to that?
Yeah, like Andre said, I I took I did radiation with Dr. Tang as well. I did 2 separate sessions, or I guess I did like a week. Sorry. I did 2 separate sessions with him a week at a time. Because my RMC spread to my liver and to my lungs. So they did spot radiation treatment on my kidney, or my kidney, but on my liver and a couple spots on my lung. And like Andre said, it was pretty simple. Once they pretty much mark every area that they need to mark, and they take the mold of your body that you pretty much lay in. It's really quick and painless in comparison to, you know, going through chemo treatments. So that's probably the easiest part of my treatment cycle, actually. So Dr. Tang is he's really great, very personable, answers any questions that you have, and he's a great doctor. So
Thanks, guys.
yep.
Did you have any other questions right now, Alex, or was that about it?
No, I think the questions will come as I hear you guys talk about different experiences. I wasn't even planning on speaking that much today, but I feel really comfortable and it's like a safe space, so I'm happy to be here.
Gotcha. Well, feel free to chime in and feel free to ask your questions because we're here to help and share our experiences and our journey with you. So thank you for sharing.
Of course.
Zoe, can you give us a quick introduction about your journey?
Yeah, so so yeah, so I was recently diagnosed with RMC, I think June of this year, so I'm still pretty new to everything. Um and it kind of caught me by surprise just cuz I recently just retired from playing professional basketball overseas. So kind of caught me by surprise just because like I'm a very active person and I stay in the gym and I try to eat healthy and stuff like that. So a lot of this kind of caught me by surprise. But uh oh yeah, and I live in North Carolina, if I didn't say that, by the way. Small town called Forest City. It's like 45 minutes away from Charlotte. And yeah, just one day, everything was normal. Like I said, I'm still in the gym, exercising, doing everything. And one day I just end up having stomach pains and me just being me, just not really thinking anything was wrong. Just started taking Pepto Bismol, thinking I just had like a small stomach ache or something like that. But the stomach pains just were consistent for like 4 or 5 days, and they were just consistent, like they never went away. And then I end up having blood in my urine, so that's kind of what made me go to the doctor. And once I got there, that's when they kind of told me that I had a mass on my right kidney. And as they was doing more and more research, they had told me that it was stage 4 and that it had spread to my lungs and lymph nodes. And yeah, so like I said, I'm still pretty new at this. So I don't really know. Well, I know some stuff, but just as far as treatment, I'm kind of just starting. I just got my port put in like last Thursday. Today I just started my lab, so they just took blood work and stuff, and I actually start my chemo tomorrow for the first time. So yeah.
It's your, oh, I'm sorry, Andre.
Go ahead, Miss Ritchie. Go ahead, get you.
I'm going to ask him if his physician is in contact with Dr. Masal here at MD Anderson.
Um, when I talked to him, he said he would reach out to him on my behalf, but that was maybe like 2 weeks ago. I haven't heard anything else about it, so at this point, I'm not really sure. I guess I could reach out again to him and ask him, but you know, I haven't really heard anything back from my physician yet.
If you wouldn't mind, though, copy my email and send me your information so that I can touch base with Dr. Masal to confirm. I just need all your physician's information so that I can reach out to him.
Okay.
If that's okay with you.
Yes. And what is your email? I'm sorry.
Okay, I put it in the chat. It's Ritchie, Ritchie, at chrisjohnsonfoundation.org.
Okay. Yeah. Okay, I see it.
You see it, and my number is there as well.
Okay. Yeah, I got it.
Okay.
Oh, did Zoe just leave us?
I think Zoe had cut out.
Yes, something happened. Oh my gosh.
Yeah,
He'll be back.
Yeah,
He'll be back in a second.
hopefully we can get him back in here.
Oh yeah. Oh yeah.
I know we have Miss Daisy Reyes here. I got your message in the chat. You don't speak English.
Does she understand English? I guess is the next question. Daisy?
I think Daisy's been on before. As I recall, she might have been here last time.
I don't remember her.
Yeah.
Yeah.
Was she?
Yeah, she was. I wonder if she ever got Danielle's
So
information.
Daisy's communicating in the chat window right now.
Yeah, she's chatting.
Because we can get her in contact. Did you guys try to get her in contact with Daniel in Colombia?
Right. Okay, so she says she has a translator. So and Ashley's practicing her Spanish, I can see. Okay.
I'm on the Duolingo app. If y'all haven't downloaded it, it's free.
Okay. So she understands a little. So do you want to try? You want to try? Oh, wait a minute. Do we have Carissa? Do you have somebody who? Do you have someone with you who can speak Spanish?
Yeah.
Well, excellent. Let's.
Yeah, she knows a little bit. No, she's just saying hi to everybody, right?
Hi, everyone.
We just
That's
say.
my-
Just say.
Hey,
Just
Tanya.
say.
Hi, how are you?
I'm good.
Good.
And Zoe's back in. Zoe we'll get to you momentarily because we just started talking to Daisy, but we'll get back to you, man. Don't worry.
Yeah, I got kicked. Sorry.
No, it's fine. We we're gonna hold your hand, man. Don't worry. Don't worry about it. If you do, if you do, can you put your email in the chat, or if you want to send it to us personally, just send it to the organizers, and we'll exchange emails with you.
Okay, that works.
So,
Who's gonna try speaking with Daisy? Don't all shout at once.
Someone
Come
take.
on, Andre. You're leading this group. Try it
Well,
a little.
I'm
Daisy
a,
has a translator, so let's try talking with her. She has a translator.
okay.
Okay.
She,
Yeah.
Daisy, is your translator on the call with you?
She's muted.
Daisy?
Okay, so I think she's saying she can translate the meeting. So let's try a couple of things like this. Daisy, are you on the call because you have RMC,
It's her daughter.
renal medullary carcinoma, or are you on the call for somebody else?
It's her daughter, Rick.
Okay, so she's on. So Ritchie, why don't you fill us in what we know about Daisy? That would be a good
Okay.
start.
What she put in the chat is that she does not speak English, and that's why she's writing. But her daughter was diagnosed in November 2023. She's 12 years old and finishing her second chemotherapy regimen, 30 sessions in total. And she had a radical left nephrectomy and recently had a liver ablation. So she looked like she's had 30 sessions in total.
Yeah,
So
and from
that
what I remember last time, Daisy said that she lives in Colombia,
Yes.
like as well.
so I guess the first thing is that we can put Daisy. Uh, Ritchie, do you want to say a little bit about that we have some RMC people in Colombia and see if Daisy would like to be connected to them?
Yes, I mean, that's what I was asking Clarissa since she was on the last call. We can connect you, Daisy, with Daniel and Diana that lives in Colombia. Their son is a little bit, he was around 12 years old when he was diagnosed with REMC, and he is now 16, going on 17, and has done well. So he received all his treatment with consults being consulted by Dr. Masal here in the United States. So just let you know that there is hope. And just because you're in Colombia doesn't mean that you can't have a great outcome. So we just need to know what we can do for you, your contact information, so that we can get you in contact with the couple
She,
that's over in
she put
Colombia.
she put her email address in the chat, Miss Ritchie.
Right.
Did okay.
So her email's in the chat, and I'm sure Miss Ritchie will take care of connecting you. Are they in Bogota? Do you remember? I think they are, aren't they, in Bogota, Daniel?
No, um, no, they're in what's the one that start with an M?
Medellin.
Yes.
Oh, they're in Medellin. And and
Yeah.
and where do you live in Colombia, Daisy? You can put it in the chat. We're watching. In Bogota. Okay, well, we will connect you. Miss Ritchie is very good at connecting people, and maybe they'll even come on to the meeting with you next time, because that would be great. Because they can translate for you right on the meeting.
Hmm.
But and Daisy, do you have any? First of all, I guess is Dr. Masul working with your people in with your doctors in Bogota? So we'll see. I can understand the Spanish that's in there, and I know that Daisy is looking for just hope and not to feel alone by being in this group.
Okay, she said yes, pediatric oncologist in Bogota. So
Right. And is the pediatric oncologist talking to Dr. Masoul at MD Anderson? Because he's the expert. But if not, I'm sure that Daniel and Deanna can make sure that happens. Okay. Okay, so he is talking to them. Okay. So the last question is, how can we help you? What else can we do? Is there anything you'd like this group to do for you, other than put you in contact with Daniel and Deanna? And Miss Ritchie, what's their son's name? I forget.
Nicholas.
Nico. That's it, Nico.
And he's doing very well now.
So. Okay. If you think about any way that we can help you, can you give me Nico's parents' details? Yes, we will do that. Miss Ritchie, if you want to maybe put
I
it in the chat directly to them, or however you want to do it.
Okay, I will.
Okay.
all right, thank you, Daisy, for being here with us with this group. And we're gonna get you connected with Nico's parents in Colombia. So thank you for coming on and sharing your info with us, and let us know any way that we can help you moving forward. Okay, Rhonda, can you give us a introduction about your connection with RMC?
Can we go back to Zoe, Andre? Captain Andre, and finish up with Zoe? He's back on now.
Okay, one second, Rhonda. We're gonna go back to Zoe real quick and finish up with Zoe. So, Zoe, you said that your oncologist was going to get in touch with Dr. Masao. Is that correct? In North Carolina?
Yeah, he said he would get in touch with him for me, but I guess that was about 2 weeks ago. But I haven't heard anything back from him, so um, I guess I'll reach out to him again just to see how it went or what happened. So
And what hospital are you being treated at? And your oncologist?
it is Levine in Charlotte, North Carolina. Atrium, I believe, in Charlotte.
Okay, gotcha.
Yeah,
Do you,
it's Atrium.
so do you have any flexibility at all with your hospital? Does your insurance allow any other hospitals or not?
Yes, I believe they do.
I mean, the reason I'm asking you is this, that I have heard of Levine. I'm familiar with Levine. I'm sure it's a good cancer center.
Hmm.
And for sure, um, our experience with RMC is that Dr. Masoul has to be involved. Um, the hospital that I would personally choose, even though it's probably further away from you, would be Duke, because the doctors at Duke, especially for kidney and genitourinary, are excellent. They're really, really good, and we know them very well
Okay.
at ANCAN. So, are you close to Charlotte, or are you like halfway between Charlotte and Raleigh, or?
So basically, I'm between like Asheville and Charlotte. So I'm about
Oh,
45 minutes to an hour away from Charlotte.
oh, and you're probably 3 hours from Duke, right?
Right.
Okay. Well,
But I
I'm sure
mean,
that.
just depending, like on how many times I have to go there. I mean, if it's
Yeah,
necessary, I could get there.
yeah, yeah. Um, well, this is a tough one. I mean, we feel quite strongly, especially with these rarer diseases, that you need to be at a center of excellence. Um, I'm not sure that Levine. I'm just looking it up. Cancer Center in
Charlotte.
Charlotte is, unless it's but it might be affiliated with UNC. No, it's Atrium Health. It's not.
Yeah, it's Atrium.
Yeah. Um, my advice, and I can find out very quickly for you. I see your email, and I'll let you and Miss Ritchie know. But my advice would be to strongly consider um, involving Duke. That
Okay.
they're really really good with. I don't know. I should have asked you where you played ball in North Carolina. You probably played for UNC, and you don't want to go anywhere near Duke. Is that right?
Nah, nah. It's nothing like that.
Okay. I
I
got
actually like
I got
Duke.
to be I got to be careful in North Carolina. You know that, right?
Yeah, nah, it's tough, but nah, I'm actually a Duke fan, so yeah, we're fine.
Oh, okay. Um, well, let me write to Dr. Dan George, who's one of our main men, or I've also got, there's another urologist there who we're pretty close to. In fact, she just wrote to me today. Let me ask them. I mean, it may be worth your while switching. I will ask them what they think. I would hope that your doctor's gotten in touch with Dr. Masul, but there is a problem, which is that sometimes, and I'm sure Miss Ritchie has seen this, the doctors don't like to consult with other doctors, and
Yeah,
and and it's not good because it doesn't help. They think they know it all. They figure they got it all worked out, and it ain't like that. And I know that if we got you to whoever is the best person for RMC at Duke, that they'd be talking to Dr. Masul in a heartbeat because they're very
right,
collaborative. And what we want to make sure is that's what you get. So it's really, really important. I mean, if you talk to the people who are on this call right now, most of them have been involved one way or another, either directly or having to go down to MD Anderson, but they've all been helped greatly by Dr. Masul, and we want to make sure you get that too. So I will do my homework for you. I will keep Miss Ritchie involved. And, obviously you're going to start tomorrow. But we hope that the chemo that you're getting is the chemo Dr. Masul would approve. Um, Frankly, if it were me, I would want that confirmed, but I don't know. Do you know what you're getting tomorrow? Do you know? Have they told you?
um, they told me, but like I said, I'm still pretty new at this, so I
Yeah,
don't actually remember. So,
yeah, yeah.
oh wait, hold on. I think my wife has the paperwork. If you can give me a second, we can.
Okay. And then
Um,
Miss Ritchie, you're the expert here.
No, I think Andre is the expert.
Oh, Andre's the expert. Oh, now we're in big trouble. then
I
we're in big then we're all in big trouble if that's the case.
I got the info, Rick. I got it. um, Should we tell Zoe
whilst you weren't a basketball player, you were a captain in the army. Should we tell Zoe that and see what he says about that?
Yeah. Well, yeah, she's still looking for it. So,
Okay, well,
what is it? I'll try to pronounce it. It is so it's four doses. Oh, these are some big words. Uh, methotrexate, vinblastine, doxorubicin, and cisplatin.
and cisplatin, yeah.
Cisplatin. Yeah.
Yeah,
Yeah. So those are the four doses that I'll be receiving.
right. Do you recognize any of those? Do you recognize that treatment, Andre or Brian?
Um, Normally they pair doxorubicin up with gemcitabine. Um, I never heard of that specific, combination
Yeah.
together.
Yeah, this
Yeah,
is
I'm
sort of,
curious too. Because it's like also too doxorubicin, you can only have so much as well. So I'm wondering if that's the best combination, and that's something you kind of want to make
yeah. I
sure.
mean, I kind of feel like, and this is a tough decision, and I don't know what Miss Ritchie and what Andre and Brian, etc., would say, but I kind of feel like I would want Dr. Masoul to sign off on what they're giving you to begin with. Um,
Okay.
I think it's really, really important. Um, Miss Ritchie, what do you think? Would you plunge in like that right now, or would you look for Dr. Masoul's blessing?
I think it's important that his physicians do consult with Dr. Masal. Are you having your treatment tomorrow, you said?
Yes. So yeah, it starts tomorrow morning, actually.
Yeah, so I'm not too sure we'll be able to. I mean, I can email Dr. Masal now, but he would have to be the one to consult with your physician. So if you could shoot me an email tonight
Hmm.
and with what you will be getting on tomorrow, and let me shoot it to Dr. Masal. Also include your physician's name. Because the thing is, Dr. Masal cannot reach out to your physician, but your physician can reach out to him.
Okay.
Okay, and Zoe, you might want to just tell them you need to defer. You don't even have to tell them why. You might want to say, I need to defer for 24 hours or 48 hours.
Okay.
Um, I
Well,
I do think.
I'm thinking if maybe he could talk to his physicians and ask them then if they could get in contact with Dr. Masal, because he'll respond pretty quick. I'm going to put his email in the chat.
Okay. Ritchie, the problem is, and we've seen it before, these doctors sometimes just don't do it. They don't want to
I
talk to
know.
other doctors. And
Yeah.
and and that's why, I want to be sure you're treated somewhere where they're really familiar with with RMC, uh, and they're willing to reach out to Dr. Masoul, and they're willing to adjust the treatment when is needed.
Hmm.
And so, we and if Dr. Masoul, um, we obviously he doesn't know the details of your case, but I think what you can do, and this is what we recommend everybody, you can advocate for yourself, and you can go in there tomorrow and say, look, and I'm really not comfortable proceeding with this unless you have the blessing of Dr. Masoul at MD Anderson. And if you
All
say it to
right.
them directly like that, and say, I need to see he has approved this combination that you are suggesting, and once I see his approval, I'm ready to move forward. But he is the expert, and he's willing to talk to you. Please, can you reach out to him? Um,
Okay.
I cannot we
I was going to ask, so when were you diagnosed, so?
Um, in June of this year.
Okay.
You know, we cannot stress enough that he really that there's nobody better in the world really when it comes to, well, maybe his mentor, Dr. Tanier, at MD Anderson, but really between Dr. Tanier and Dr. Masul, there is nobody better.
Right.
And you know, we don't know how many cases these people see, and then they look at the books and they say, oh, what do we do with RMC? And they come up with some combination of 4 drugs, and just like Carissa says, maybe they're giving you the drugs at the wrong time, and maybe it needs to be a different combination to begin with, or maybe they're spot on and it's great, but we don't know, and we want to make sure you get the best possible treatment. And
I
I
tell
will
you,
reach
Right.
out to Duke.
give me the name of those drugs real quick, and I'm going to text Dr. Masal now.
All right. I'll put them in the chat.
Okay.
Yeah, that would be great if you.
Or would you like me to try to say them for you, or
No,
would you
put
like
them
me
in
to
the
set it?
chat.
Okay.
Whichever.
It's probably going to be. It's probably going to be easier for you to sink a 3-pointer than it is to try and say them again. So
Yeah. Yeah.
so put them in the chat.
Was there a reason why they waited till now to treat you from June to now?
Honestly, it was like they were just running a lot of tests. They really just couldn't find out like what was wrong. Um, I think at first they I think at first they were thinking it was like clear cell, and
Mm.
then maybe like a week or two later, that's when they came back and told me like it's RMC.
A week or two later?
Yeah, so
Like,
they
I'm sorry,
were they
2 weeks ago, or a week or two later in June? Um,
it was like July 23rd. So I mean, yeah, it was like July 23rd when they told me like it was RMC. So before that, they were just running a lot of tests, just trying to figure out what it actually was, because they were just saying like, well, it might be cancer, it might not be, it might just be inflammation, because because at first they were like, okay, your pancreas is swollen, but we don't know why. And they were just saying, we see the mask on your kidney, but they just still was just trying to figure it out. So eventually they just came out and said, yeah, like we definitely know it's RMC now.
Well, you see, that's another thing that I would say is that, and I mean, the area I spend a lot of time in is in prostate cancer and advanced prostate cancer. Sometimes you need to get a second opinion on the diagnosis, and you know, I would want Dr. Masul to sign off on the diagnosis. It seems like they've been struggling to come up with the right diagnosis. I'm not saying they're wrong, but I
Yeah.
am saying, oh my gosh, I really would want somebody who's an expert to confirm this is what I've got.
Yeah,
You
definitely. No, I definitely
know?
understand. Like, yeah, so
yeah, and when you reach out, I wouldn't like have them wait 2 weeks or not. I would say like making sure you're following up every day, because this is pretty aggressive cancer. So 2 weeks can make like a different, like, can, make a huge difference. So when you are following up, you know, just make sure you guys are advocating for your like self and getting prompt responses from them as well. There.
all right.
You guys, we still have a couple more on the call that hadn't had an opportunity to talk as well. Rhonda.
All right, we're gonna keep moving along here. Rhonda, can you give us an introduction and your connection with RMC?
Hello, everyone. Yes, I'm the mother of Justin Jefferson. He is 35 years old, my son, who was recently diagnosed in April. However, he started having pain in his back area in October, November of last year. So when he first went to the doctor, it wasn't until January because he thought he had just pulled a muscle or whatever. So when he went to the doctor, they did an x-ray and he had a lot of fluid in his lung area. He was first diagnosed with pneumonia. They, long story short, they ended up doing a biopsy and they couldn't come up with what was wrong with him. They sent his tissues off to different labs across the country, Boston and in a couple other places, and nobody knew what it was. Um, they diagnosed him later with cancer of unknown primary because it was definitely in his lungs. And they didn't know where it started. They gave him treatment. We from Baton Rouge, we live in Baton Rouge. Um, and he was initially seen at Maryburg Perkins at the oncology session doctors there. They did give him uh, a generic treatment because he was started going downhill. He was losing a lot of weight. He's lost over 50 pounds and in a lot of pain constantly. So they gave him a generic treatment and it seemed to give him some more energy. But then the second time they gave him treatment, he had a bad reaction to it. But they did refer him to MD Anderson. So this is like the end of March. By the time he was referred to MD Anderson, and in April, I may have the dates wrong. He's sitting here listening, but it's hard for him to talk because of his voice has been messed up because of the lungs and all that. He was originally treated at MD Anderson for the cancer of unknown primary and put in a clinical trial. That clinical trial, he ended up being in the hospital for several days because he had an allergic reaction or side effects to the medicine. They started doing more tests, and finally, they did a test on his kidneys. They never touched the kidneys, even though he had a lot of blood in his urine at points. Nobody ever tested his kidneys that I'm aware of prior to that. Long story short, once he was seen by the research specialist that was testing his kidneys, they referred him to Dr. Masul, and they said, we think you have RMC. So it's been a long journey just to even get a diagnosis on him. It was a relief to us because we finally knew where it started, because we knew it was in his lungs, but we didn't have any idea that it was in his kidneys. So he has had, I don't know how many, 1 or 2 rounds of treatment with Dr. Masul. 6. He started a new treatment regimen a few weeks ago. I think the last one he was supposed to start because the first one didn't seem to be working. And I don't know the names of the medicine that he's taking. But the last one that he's on, it was supposed to be on a weekly basis. He was scheduled to go last week, but he was just not feeling very well. So he's going to try to go this weekend and see the doctor. So that's been his journey and our journey with RMC.
Well, thank you for sharing, Rhonda.
You're
I
welcome.
know the RMC journey can be definitely a long and difficult journey, but we do have people that have made it out on the other side. Myself included. We got Brian on the call here. Um, and some others as well. So, just relate a message to your son. Tell him to stay encouraged, and he's with the right oncologist. Dr. Masao.
He is. We love the doctor, and he's just so
Yeah.
personable and very helpful and encouraging. And I did speak to Ritchie a few weeks ago, and she recommended that my son Justin, who is listening, I'm sorry, we have grandkids, um, speak to you and maybe connect with you at some point, Andre,
Okay.
for
Okay.
support and encouragement. I put his email address, but I need to put his number.
And I'm gonna put my info in the chat as well, so
Okay,
y'all
that'd
y'all can have that. You can reach out at any time.
be okay. Thank you.
Did did he have any questions, or did you have any questions? Um, yes.
Not at the moment, because I'm not sure what medications that he's taking now. Um, so when I find that out, we will reach out to you.
Okay. Okay.
Thank you.
Um, all right. Thank you. Thank you for sharing. Rick, you have your hand raised, Rick. You can go
I
ahead.
do have my hand raised for a couple of reasons.
Okay.
First of all, Brian, would you maybe you could also put your email in or send it to Justin as well, because two voices are better than one, and
Yeah,
yours,
I'll drop in the chat.
yeah, and yours is a very, very good voice. Secondly, I wanted to say to Rhonda that Rhonda, we have a Care Partners group that you are very, very welcome to join. If you want to put your email either directly to me at the bottom, Rick, or you want to put it in the win, we'll get a reminder out in case you need a little bit of support, because we know the Care Partners need lots of support as well. So those were the two things that I was going to suggest. And I see Alex has his hand up.
Okay, Alex, you can go ahead, Alex.
Yeah, I wanted to add something actually because what Rick was saying earlier resonated with me, and it's something I forgot to disclose when I was sharing my journey actually. When I was first diagnosed, they didn't know what it was. Like I said, they took a biopsy of my lymph nodes. They actually had in their laboratories the RMC sample, so they were able to diagnose me, but they didn't have any records of any patients at my hospital that had that before. So the oncologist that I was assigned is a renal cancer specialist who had to basically make a lot of calls and figure out who was the best specialist that could answer these questions. One referral to another, he ended up getting in contact with Dr. Maswell, who shared his expertise with him and told him what kind of regimen I should be on. Now, at first, this was all good and well. However, moving forward, my relationship with my oncologist has been a little bit tricky. He has basically stopped communicating with Maswell. And it's really gone to a point where whenever I bring it up, he simply refuses to acknowledge it. So let's say I'll text him and I'll ask him questions about something. Anything that I mentioned about reaching out to Maswell or asking for additional guidelines is totally ignored. I've spoken to him about it in person, by text, on the phone. I've met my fourth request by now. And so what my brother did actually is he reached out to the doctor, Dr. Maswell, via Facebook Messenger, who confirmed that he hasn't heard from my doctor in a while, and he would actually really appreciate an update on my situation because since he's my assigned oncologist, he's the only one that he can really speak to. He can't speak to me directly since he hasn't met me yet, and he can't speak to any other doctors I'm involved with that aren't actually treating me for my cancer. So that's the main reason that I'm actually going to Texas at the end of the month. We're kind of exasperated with the care that I'm receiving from this specific doctor. And we're also in the process of maybe switching oncologists here because we're looking for an oncologist that is more cooperative and that is willing to actually reach out to Maswell. It's not so much about having a doctor that has all the answers. In cases like this, like you said, it's a rare and aggressive cancer. You're looking for an open mind and a collaborative spirit, and we just feel like that is not what I'm getting right now. So I just wanted to add that because when you said center of excellence, I do feel like I'm at a good hospital, but I just don't feel like I'm working with a very cooperative and, let's just say, empathetic oncologist.
Yeah. Where are you being treated, Alex?
So, like I said at the beginning, I'm in Montreal, Canada. The name of the hospital
So,
is
yeah.
French. If you want, I can put it in the chat.
Yeah. It's a big problem, and especially when you're in some of these Canadian. And we do a bunch of stuff with Canadians in all of our groups, and you have to find the right doctor who is not who's comfortable enough in their own skin that they don't mind reaching out, and that's not always the case, and it's really sad, and we've seen it many times. I lost a very dear friend to a blood cancer at the end of last year because his damn doc wouldn't reach out to Mayo where he'd been treated. And he got rushed into hospital here in Tucson, and he'd been treated at Mayo, and they didn't connect with each other. And so we recognize this as being a very significant problem. I can't help you too much in terms of, well, maybe I can. Let me think about this. I may be able. There is. I'd rather refer you to a GU medical oncologist, but Fred Sard is in Montreal, and whilst he sort of knows me, but whilst I don't know him personally, one of our advisory board members in Houston, Dr. Efstathiou, knows Sard really, really well. And I could ask Sard for his advice on your behalf, and I'd be very, very happy to do that.
I would really appreciate that.
Let me just see which hospital he's in.
I just googled him. He's at the hospital where I'm being treated. The Shum. I don't know how to pronounce it in English.
Chumont.
Yeah.
Montreal. So is he also at Montreal?
Yeah, that's where I'm being treated right now.
Okay. So do me a favor, just send me. We may be able to work. We may be able to work this a back door on this, because I'm pretty sure I can get Dr. Efstathiou's help. She's a very good friend of. They were colleagues, and she moved across the street to Houston Methodist, and she's a very good friends with Dr. Masoul. And if we work between Dr. Sard and get Dr. Sard involved, we may be able to break this down a little bit. Just let me know. Just let me know the name of your doc, and I'll follow up with it for you, Alex. I can't make any promises, but we can try.
Definitely. Like I said at the beginning, I'm trying to put all the odds in my favor. Regardless, I am coming to Texas in a matter of weeks, 2 weeks at this point, to meet Dr. Maswell. So I'm excited for him to actually meet me and treat me and see me and just be able to run his own tests. But anything that can be accomplished here, obviously, is very practical. So I'm really grateful for your help. Is your email in the chat?
Just if you click at the bottom where it might say everyone, and just click on my name. Which should be somewhere there. Ooh.
When I click on it, your email doesn't appear. It just says
no, it doesn't appear. I wonder why it doesn't appear. That's pretty weird. All right, I'll put my email in the chat for you. I don't know why it's.
But overall, I'm not trying to diminish my doctor or say anything like that. It's just
I get it.
he was very willing. He called him at least once or twice at the beginning. He wanted to understand. It's just that I feel like he feels like he has control of the situation because my latest scans are stable, and so he doesn't maybe feel that sense of urgency. But like we've said multiple times on this call today, it's an aggressive cancer. It can be very unpredictable and it can switch up overnight. So it requires that
Yeah.
additional care, and I just feel like he's at a point where he maybe has lost sight of how serious this is.
Okay, well, since it's all in the university hospital, we may be able to address this one, and I'll write to Our Lady, Dr. Efstathiou, and see if she can help straighten this one out for you. She's terrific,
Thank you
and
so much.
she may do so. And I just put my email in the chat for you,
Got it.
rd@ancan.org. It's Rick. Okay.
Sounds good. Thanks again.
Yeah, and well, Alex, I just wanted I'm gonna put my phone number in the chat as well. Like if you have questions, I know like my husband, he had treatments in Texas and New York and would fly back and forth. And his doctors were good at collaborating on that. So like if you ever have questions on that, you can reach out to me as well.
Great. Thank you
Yeah.
for sharing that. I'm saving all of you guys' information.
And save it and keep coming back. And I may actually have Fred Sard's email, and if I do, I'll write to him directly, and I'll copy Eleni, Dr. Efstathiou, and we'll see what we can do to cry. And so it's really important that you're hearing this, because this is what happens, man. And this is what bothers me. So we want to make sure you've got the best team that you have around you.
I have some
Yeah.
information for Zoe, so I need you to either call me now after this meeting, or
Is that the right treatment combination, Ritchie?
I really don't want to put it out on the recorded.
Well, we can put it out. We do it in all our other groups, Ritchie. But is that the right treatment? I mean, or does he need to switch his
That's
doc?
that's not one that's suggested.
It's not the one that's suggested. Okay.
Yeah.
So Zoe, if it's not the one that's suggested, defer for a couple of days. Ritchie will work with you. I will try and find the right doc for you at Duke. And between us as a team, we'll get you to the right place. And,
Yeah, I really appreciate it.
listen, man, it's a
Yeah,
pleasure. And we put these recordings out in all our groups, and we talk pretty openly, and it's effective.
yeah,
We make a difference, and this is how we make the difference. So, and it's important that people who listen to this hear it, because it gives credibility to the group. So we will do our best to steer you to the right place. So
Do you have my number, Zoe?
yeah, I do. I'll give you a call after this.
Okay.
okay, and so I wanted to say something else to you, which might not have been explained. RMC occurs very frequently in athletes. It has a propensity to, as you probably know, to African Americans and to Hispanics. So
Yes.
most of the people that we see get done, not all, but a good portion of them, Ritchie can tell you the exact number, but it's probably higher than 80%, are either people of Mediterranean blood or African American. And because of its nature, if you have not stayed well hydrated, you're more likely to be afflicted with RMC. And so for lots of young athletes, they drink and they're thirsty, they drink, but it's not in front of them all the time. They got to be drinking, But we know that
Yeah.
it can be really, really important. Do you does your family carry, or do you carry sickle cell trait? Have you ever been tested?
Yeah, so I basically known about it since I was a kid. Like my mom always kind of drilled it in my head because um I have like asthma and stuff like that, but she always constantly drilled that, you have sickle cell trait. Um
Okay.
and it came from my dad's side.
Hmm.
My dad doesn't have it, but my uncle does, and
Hmm.
my uncle has like 5 or 6 kids, and every one of his kids has the sickle cell trait.
Hmm.
So
Yeah.
yeah,
So yeah, it's not surprising, but then if you have that sickle cell trait, it is so important to stay hydrated. And not everybody has sickle cell trait that has it, but I think most do. Is that right, Richie?
That's correct, Rick.
That
Most
is
do.
correct.
Yeah, yeah, yeah. So, but we got your back, man, and we'll get you sorted, and we'll try and get Alex sorted, and so
yeah, I definitely appreciate it, and it means a lot. Yeah, you guys have made me, very comfortable tonight, and I just really appreciate it.
yeah, yeah, yeah. Talk to Miss Ritchie and think about deferring your treatment a couple of days, and let's lean on your docs to talk to Dr. Masoul before you get treatment. And in the long run, let's see if we can get you over to somebody at Duke, and I'll write to um, Dr. George and Dr. K tonight, and get their opinion. They're both at Duke.
Okay, all right.
All right. Thank you for sharing, Zoe. Ashley, did you want to share your scan update with us tonight?
Sure. Um, so I had a scan on July the 15th, and I had my first allergic reaction. Um, it was a very crazy experience. I think about it probably every day. I thought that was not to be discouraging, but it was just a real life moment. I'm giving you the real spiel here, but I thought I was out of there. like I stopped breathing. Um, my heart slowed down. It felt like a lightning strike to my um abdomen area. I started my period immediately. Um, and it was like so many nurses in the room. Everything was happening so fast. And they treated me with an EpiPen. I wound up in the emergency room. That's where I woke up, and I was fine. It was just like the weirdest thing ever. And mind you, that was my ninth cycle. Dr. Masal, he recommended 10. So I was on my way there. It was my last bag of the treatment, one more hour. And within 10 minutes of me receiving that bag, I forgot which one he said it was, but that's the one that gave me the allergic reaction. So after that, they discontinued my chemo until I did scans. Um, and my scans came back that some areas are clearing, and then some areas it's like tiny, tiny, tiny new findings. So, at first I was worried because of the way that they worded on the scans is like disease is worsening, concerning, increasing, but the doctor was like, this is not life threatening. He showed me like the tiny amount of growth. So when they say increasing and worsening, I mean, technically it is increasing, but like by the size, it's really to nothing. So he told me everything is still stabilized, and I'm still doing really well. So he just assured me that um, going forward, I will be doing I forgot the D word, but with the gemcitabine going forward with that, and they're gonna test my heart this Friday, um, just to make sure my heart's ready to take on this combination. And I believe I start next week for the new combination once my heart results come back. Um, and his plan is to give me six treatments of that. Just seeing how I do with it, and hopefully, the goal is to obviously shrink it as much as possible so we can get to the radiation stage and get to zipping and zapping. And that's pretty much it. As far as my update, I've gained, I don't know about y'all about losing and gaining, but I've gained all my weight back and a little bit of more. I'm not too sad about that. Um and so my doctor said I am in good shape to withstand this chemo. So hey, I'm gonna take this extra meat and use it to apply and be strong. Um but I still, this time I was a little worried when I saw the scans. I was a little discouraged, but I don't know. Lately I've just been feeling different, just like, um all news isn't necessarily bad. I feel like it's going to be a brighter side to things. Like today doesn't define tomorrow, like so. I just got to keep your head up high. And I took the news, and he's excited. He's telling me that he's working with Dr. Masal. He even gave him a compliment of calling him the expert and from a doctor here. I'm like, oh, okay, so you're not shy to contact Dr. Thank you, because the last one, I don't know if you guys remember, but they just switched. I had another doctor before and he moved, so I was a little scared about this one, but this one is more receptive to speaking to another doctor without me asking him, because that was one of my questions, and he kind of was like, and I spoke to Dr. Masal and he said that. I'm like, okay, great. Okay, great. So that's pretty much it. I'm doing good over here. I hope this is the same for you guys.
And what about the tumor marker? You said CA-125. How did that?
Yes, so my cancer count, I guess it is, right?
It's a tumor marker, cancer antigen 125.
Okay, so that has been fluctuating. I didn't know anything about that until recently. My first marker, I think it was like um about 70 something, then it dropped to 40, then it went back up to 85, and now today I had an appointment today. It's at 71. So it went down from 85. Whoop whoop. Um Whatever that means. I don't really know like the counts and all that stuff, but I didn't really ask either. But he was just saying an average number he believes is like under 10. So got about 60 something more to go to get there, but just taking one step at a time. Mr. Andre,
Thank you for sharing.
you're welcome.
Ashley, Captain Andre, please.
Yes.
Oh, my apologies, Captain Andre.
Get the captain in front of it, okay?
I apologize. Everyone, please forgive me.
Well, we appreciate you for sharing, sharing giving your update and sharing your scans with us.
How you feeling, Ashley?
I feel good. Some days it feels like I'm getting too much sleep and still waking up tired. But I keep trucking, just keep, going along. I'm trying to incorporate more active activities because before RMC tried to take over my life, very into yoga and stuff. I tried stretching for the first time since last year, and guys, don't not stretch, okay? Like keep stretching, please. Like I feel like I'm starting over back in middle
Uh,
school, you're trying to get flexible and everything. So I'm a little stiff, but we're good. We're good, Rick.
no, you. That's really, and you know there's another good tip in there for all you who are going through chemo right now or about to start, Mr. Zoe. Um, if you can exercise during your chemo, it is huge.
Hmm.
It is huge. It makes such a difference. I know it's counterintuitive. I know it's the last thing you feel like doing, but even if you can get out and walk a little bit and keep exercising during your chemo, it really, 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 really helps. And the studies show it. I mean, this is not just me spouting. This is these are the studies that show
Okay.
this. These are the studies that show, and so that doesn't mean to say that you've got to be lifting, bench pressing 150 pounds or whatever. It's just basically keep doing some aerobic, doing some weights, a little bit of weights, light weights, and as Ashley will tell you, stretching, because if you don't stretch,
Please.
your muscles forget quickly, right, Miss Ashley?
Yes, they
Yeah.
do. I mean, I'm reminding them though. I felt it this morning. I'm like, okay, we going in the right direction. When I feel this way, I'm like, this is a good feeling. Not because I'm tired, but because I'm actually putting my body to work. I walk and everything, but I'm still trying to figure out like what's a really good, effective workout plan for me because of the lung situation. They start burning after a while.
So
So
why don't you take a look and see if there is a Live Strong program at one of your Atlanta why the what's it called, YCA? What, YCA? No, what am I trying to
like
where the
swimming,
gym is?
YMCA. Is that what you're saying?
YMCA. Yeah,
Okay.
sorry, I just had to see him. Check. I'll look in a second, but see, the YMCA runs these Live Strong programs. They were originally Lance Armstrong programs, but they've been taken over. They are specifically exercise programs for people with cancer, and some of them going through treatment. And they will help you design exercise programs for your cancer. They're
Okay.
free. They're 16-week programs that you've got to figure out what to do next. The other thing is to look and see if there are any cancer trained specialists in your area, because if there are any physical trainers who have a cancer training, those are really good people to deal with. Tyneal, I see you have your hand up.
Yeah, it actually was just pertaining to the physical activity part. I was curious, is there like a certain cap to it? Because I talked to my doctor about it and I asked them, can I resume, my physical activities? And they said, usually RMC is caused by physical activity, but you can go ahead. And I'm like yes or no? Is that a good thing? Because I don't want to like impede the process of getting treated. And they're saying that me working out is making it worse. But now, obviously, hearing you guys saying that it's more so about hydrating, I just want to make sure that I'm not, like I said, I want to make sure that I'm not doing harm to myself. But is there like a certain level to where you should be like, all right, don't work out to this much? I know you got to listen to your body, but
Yeah, working out in moderation is good. Like the issues when you try to do like high intensity workouts, high intensity exercises, especially in like humidity or elevation or um, without getting that proper hydration. That's where you kind of you know cross that lines. But working out in moderation, I think is really well. During my journey, I would go do walks in the park or some type of stationary exercises and stuff like that. Nothing that was too strenuous, but something to get my blood
Exactly.
flowing and to get me get my body going and feeling good, feeling strong.
right.
Exactly. Exactly. I mean, you don't want to be playing one on one with Zoe, you know, down in the park. But because that's really what they're saying. You know, don't stress your body to a point where you're gonna be dehydrated. But we know, for example, that there's an oncologist in Chicago who actually administers chemotherapy to people whilst they're walking on a treadmill. And we know how important this is. So, are you what have you been treated, Daniel?
You said what treatment? Sorry, I cut out.
Where are you being treated?
Oh, at Rex Oncology Center here in Raleigh.
Okay. Okay. No, I was trying to see. I mean, if it was a big cancer center, they do have people there sometimes who will help you with designing an exercise program. If you're at UNC or Duke, there might be somebody there. But the smaller community centers, it's much harder, and I don't think they give you the best advice either. So.
Did you have any other questions, Tanya, or was that it?
I think that's all. Appreciate it.
Okay. All right. Ms. Ritchie, you wanna give your introduction, your spiel about the C.J. Johnson Foundation and your connection with RMC?
All right. In 2011, my youngest son, Chris, who was 38 at the time, was having back pain, and eventually he was diagnosed with renal medullary carcinoma. And back in those times, REMC was very, I guess, no one really actually knew about REMC. And for sure, they didn't know that sickle cell trait was a major factor in REMC. So while receiving treatment, he wanted to start a foundation in memory. Uh, I'm sorry, my mind is sort of messed up, you guys, so bear with me a little bit. He wanted to start a foundation so that others would not have to go through what he went through and could be educated and made aware of what to look for if they had sickle cell trait. Needless to say, my son passed away 15 months later. And after he passed, I did start the foundation in his memory. And since that time, we started out small, and we're still small, but we are global and we are effective. And we're here to basically be a support person for each one of you. So I want you to feel comfortable in reaching out to any one of us anytime. We're here for you. This is a safe place for you to share what you're going through, and certainly we will do whatever we can to support you in this journey. And I'll also put in the chat, if you go to the REMC Alliance website, they have a foundation as well, and this is one that Dr. Masal run. If you look, I did put a link in there, which there's a guide that you can share with your oncologist as to how to treat renal medullary carcinoma. You have to be your own advocate. And if you don't think something is right, be sure to question it. And I'm sorry, I can't get my camera up, Rick.
So you can't see the beautiful Miss Ritchie tonight.
Well, I tell you, after all I've been through, you don't really want to see me anyway. So I say things happen for a reason.
So I was just going to say, with you can see on the bottom of our ANCAN T-shirts, because we partner with the Chris Johnson Foundation, but we say be your own best advocate. And I think if there's one thing that you can take away from these meetings, it is to advocate for yourself. It is so important. Don't put that doctor up on a pedestal. You want to be looking them in the eye, and this is your life. And and the same thing for your family. And you got to be talking to them. And if they don't respond, like in Alex's situation right now, and other situations you've heard about tonight, you have to take it in your hands. And sometimes the doctors will work with you, and sometimes they don't like it, and then you have to make the decision about, well, am I going to change my where I get treated? And it's okay if you do. It's okay. You're the consumer. You're more than the consumer. This is your life, right, Carissa?
Mhm. Yep. Exactly.
Thank you for that spiel. Man, it's been a great meeting. Do
Well,
anybody do we have any other questions out there before we wrap up tonight?
Andre, I just wanted to share that I did lose my mother, and we had her celebration of life this past Saturday. So that's why I'm a little bit off key tonight, but just want to let everyone know.
yeah, we all wish you much comfort. And may Nina's memory always be a blessing for you, Ritchie. It will for everybody who knew her, I'm sure. And it takes a while. I surely don't have to tell you, but there's a point when some of that grief becomes you start smiling when you think about the people, and you're not overwhelmed with the grief.
Right.
So, by the way, well, your email addresses. We just send out a reminder. We add them to our distribution, and we will send you a reminder before any event, any RMC event, so you'll know it's coming up. It usually comes out a couple of days before, and there's usually other stuff in there too. And if Miss Ritchie has anything, we remembered Miss Ritchie's mum in the RMC reminder that went out this time around, and so that's why we're taking it, just so that we can keep you all informed.
All right. And Miss Ritchie, we're gonna definitely keep you in our prayers. Your mom very special to the RMC community. Definitely enjoyed seeing her out there doing the RMC walk. So she definitely holds a special place in our heart. So we're gonna keep you uplifted.
Thank you.
Um,
I appreciate that.
so, um, is there any more questions before we wrap up tonight? Anything that anybody would like to add? Everybody got all the email addresses and phone numbers that they need? Go ahead. Rick, go ahead.
If you didn't, there are three little dots on the chat at the top. Those three vertical dots. If you click on that, you can download all the chat messages.
All right. Thanks. Thanks for adding that, Rick. So yeah, well, we're gonna wrap it up. Thank you, everyone, for coming on and sharing your journey with us, and um, giving us your updates. Like always, stay encouraged, stay positive, be your own advocate, in these rooms. And as always, you can reach out to Miss Ritchie, myself, I'm a moderator, Carissa is a moderator. Also getting Brian on board too as well. So we all get, different perspectives, of this journey. So we definitely will help and answer any questions that you have. And if we don't have the answers, we'll find somebody that do. So feel free to reach out anytime. So thank you guys for coming. And the next RMC meeting is September the 9th. September the 9th is the next RMC meeting. Second Tuesday every month. So looking forward to seeing you guys there. As always, I keep all y'all uplifted, in prayer. So stay
Yeah,
positive.
and if
Go
I
ahead,
can
Rick.
just say, Andre, I mentioned earlier on, we do have a really good care partners group. If any of your care partners want to come, we've got some great mental health programming. We got a men's discussion group. We got a ladies discussion group, a women's discussion group. We've even got a veterans discussion group. So, and those discussion groups are to talk about everything and anything except treatment. We don't talk about treatment in those groups, but anything else that's bothering you. We've got a creative writing class, and we've got an art class, and we've got all kinds of good stuff. So check it out. They're all free. They're all drop-in, and most of them are a lot of I don't want to say a lot of fun, but some of them are a lot of fun, but they're all very helpful. So please feel free to attend any of them, and just drop in, and you can let me know if you want us to send you a reminder, or you can change your reminders. Sorry, Captain.
It's okay. It's all right. It's okay. Yeah, so September the what did I say? 9th?
Nice.
September the 9th, next RMC support group meeting. Looking forward to seeing you guys there. Also, if you guys want to have any specialists to come on a meeting, or come on to like a special meeting, we can also arrange for that as well. I know we had Dr. Tang on here, the radiation oncologist, and MD Anderson. We had Dr. Masal on here as well. We also had like a dietitian come on as well. So, shoot us an email or a text if you want to see some of those specialists, or hear from one of those specialists. We definitely can arrange that. So September the 9th, I see you guys then. Have a good night.
Have a good night.